if people succeed on that, and if we succeed on repairing the damage, I mean getting blood pressures down, getting lipids down, then the prognosis is pretty good. Example, there's a guy, he's actually one of my neighbors, he's my same age, and he got his first myocardial infarction. He's a fisherman, got his first myocardial infarction when he was 45. Major thing. And we pulled him through, we went and put him into rehabilitation, he went back to fishing, everything worked, but he didn't stop smoking, and there were a few other things. So 98 he got another myocardial infarction, he went to coronary dilatation, and then 2 years later he had bad angina, and then on the angio we could see this is the end of the line, we can't get any further. So, and the heart transplant was out of the way. So I sat down with him and with his wife and was very open and honest. Said, these are the demands that there are on your body. Try to do that. And we shook hands and said he would try. And he didn't become fanatic, but he did the basic things, the basic way you should treat your body. I met him in the forest 2 weeks ago when I was out on one of my walks, and I almost said, are you still alive? But he is, and he is doing well. I am fascinated by how much you can do yourself, and that's I think the core of my message, and I hope that reaches out to general practitioners also. If we give the people the courage, the tools to understand that they should do the work themselves, we can get a very long way. That's a problem. If what we know, if people can't change lifestyle, of course we can help them with drugs, but the prognosis is very, very poor. We know that a person after first heart attack who continues smoking has a 50% chance to not being around anymore after 5 years. And I've used that sometimes towards those patients. I told them, my task is to inform you. And I'm informing you now that this is 1, 2, 3, these are things that are going to happen. I've seen another patient. So take it or leave it, it's your life, I can't live your life. I think it's helpful that this is a normal, universal human problem. It's nothing especially only happening in the north of the Netherlands. This is very common problems we have with our human body if we mistreat it. Mind you, I have spent every year a few months in Zambia in a small hospital. I still have to meet my first myocardial infarction patient there. And you start to wonder, why not? So probably there is something in the message on treating your body the right way. What we know, and there's a fairly recent American study showing that with very simple steps on population level you could halve the mortality in myocardial infarctions. The solution is not too complicated. The problem is knowledge. And if you look in different social classes, the difference between the top level and the bottom level in society is that you have 4 times higher risk of getting a heart attack in the lower social groups. And that researchers have clearly demonstrated that is a lack of knowledge. So I think education, and education. No more pills or more guidelines or whatever. Get knowledge across. Get people to know that if I buy a television set, I look at a little instruction book. If I get a body, why don't I read the instruction book of my body? It says 4 things: don't smoke, move around a little bit once in a while, eat properly, and get your sleep. If you do that, it's a very simple instruction book, and if you do that, you might well live until you're 90 or 100 years old. What we see there is there is continuously new knowledge coming up, and with the new knowledge we can strengthen our case to create interest among cardiologists that don't forget lifestyle issues. Don't put all your money in pills or catheters. There is a step before it's too late. And it's amazing. We have guys, good friends of mine, working in our city on the local nuclear plant. And they don't understand our way of working in healthcare. They say, we do everything to prevent a catastrophe. And you, in the hospital, you went until you have a catastrophe, and then you do everything. So why don't you do one step ahead. And that brings me to a Chinese scientist who said 2,000 years before the birth of Christ, he said that the good doctors treat the disease before it starts.